My name's Sarah Weller, and I'm a certified exercise physiologist for the Prostate Cancer Supportive Care Program. Tonight, we're going to be talking about exercise for prostate cancer patients. So I'm going to walk you through what you need to know about all of the different types of exercise and how it can help you within your prostate cancer journey. So within the Prostate Cancer Supportive Care Program, our education module has two components: the education session, which I'll be running you through today, and also a one-on-one exercise clinic that you can access after you've been to the education session. The exercise clinic helps you adopt positive exercise behaviours that are going to help support your prostate cancer, and it includes a baseline visit, a 1-month telephone call, and visits at 3, 6, and 12 months, with the goal being to help you adopt healthy exercise behaviours by the 1-year period. Today's session is going to be an overview of what is exercise. We're going to look at why you should exercise for your prostate cancer, how much exercise is recommended, the specific exercises that you need to both manage and reduce treatment side effects, so things like fatigue or urinary incontinence. We're going to look at how you enhance your health and long-term survival with exercise, and how you get started safely and continue safely. So what is exercise? Exercise is any planned, structured, repetitive, and intentional movement performed to improve or maintain one's physical health. Exercise is different to general physical activity. Physical activity is any type of movement that you do. So that can include gardening or housework, or maybe even golf or walking a small dog. Whereas exercise is really intentional to improve your health. So if you were to go for a 30-minute walk, that was to help improve your fitness or your feelings of well-being, then that's considered to be exercise. Same if you were to go for a bike ride or a swim or to lift some weights. Whereas physical activity is a bit more general. And the other activity that I want to define is sedentary behavior. So possibly that's what you're doing right now. Sedentary behavior is something where you're seated or reclined or lying down. So it might be sitting at a computer or watching television. And it's really when our metabolic rate or our energy levels are very low. So we're not actually burning many calories. Now we know that movement is very important, and sedentary behavior is actually an independent risk factor for other types of cancers, for cardiovascular death, and for other chronic diseases and things like diabetes and heart disease. So what you can see here is that if you are more sedentary, so the red line where you might walk to, you get up in the morning and you drive to work, and then you get to work and you have a sedentary job, so you're sitting down at a computer, you eat lunch seated, you drive home, you eat some dinner seated, and then you watch television. That's very sedentary, and you're at a higher risk for other types of cancers and chronic diseases and death from heart disease. Versus the person on the bottom here who has more yellow and green in their day. And so yellow is a standing break and green is exercise. So if you have yellow, that might mean you get up and you walk to work, then you sit down, you take a few movement breaks throughout your day, you might go for a bike ride at the end of your day, you do some wandering, walk the dog, and then you might have a standing desk that you do some work at night on your computer. You have a lower risk of those things if you're moving more and standing more versus sitting. So the first takeaway from today's talk is that we want you to move more and to sit less. So even if you're not at the stage where you feel confident exercising, any type of movement is very beneficial for your health. So why should you exercise? We know that the leading cause of death in men with prostate cancer is actually cardiovascular disease or heart disease. So you are more likely to die with your prostate cancer than from it. So this is really important because we have a lot of evidence that shows us how to be healthy and protect our heart health through movement and exercise. And so we want to make sure that you are exercising for your best long-term health, and that might actually mean that you're exercising with a heart-based focus to help your heart be strong and for you to function well. We also know that exercise is the most effective and evidence-based non-pharmaceutical intervention for prostate cancer. So what that means is that instead of taking a pill, you can actually use movement, lifestyle, things like exercising, to help yourself to live long and to live well with your prostate cancer. So what are the benefits of exercise? As you can see here, there are many, many benefits of exercise. We know that it's good for our heart health, for our bone density or strength of our bones. It can help reduce cancer-related fatigue. It can help improve your continence and prevent bladder incontinence. It can improve your sleep, improve your sexual function. It can increase muscle mass and strength and your body composition, improve your blood sugar control and prevent things like diabetes, manages and maintains your weight, improves flexibility and balance, and also mental health. There's a lot of benefits just from exercising regularly. When we look at how much exercise is recommended, the recommendations come in 4 categories. So we've got aerobic exercise, resistance exercise, flexibility, and balance. We're going to go through each of these categories individually. So aerobic exercise are things like walking, biking, swimming, anything that involves large muscle groups and kind of moving and getting your heart rate up. Resistance exercise are things like weight training or strength-based training. You may use dumbbells, you may use a TheraBand or some type of band or tube or a weights machine at the gym, or you could even use your body weight to actually achieve that type of resistance. Flexibility you're probably familiar with, and this is something like stretching, it can be yoga, and other forms of things that help lengthen the muscle. And balance training. Balance training is often as simple as the picture shows you, standing on one leg, helping improve your ability to balance, which helps us to move safely and helps prevent falls. When we look at the specific recommendations for aerobic exercise, we see that it's recommended that you do 150 minutes a week at a minimum of moderate to vigorous intensity aerobic exercise. So what this looks like and breaks down to is 2.5 hours of aerobic exercise per week, or 5 30-minute sessions. And you can break that up into as small a chunk as you like, and it's moderate to vigorous intensity. And so tonight we will go through what that means, what moderate is, what vigorous is, and what mild is as well. Resistance exercise, we're looking at 2 or more sessions per week of weight training for all of our major muscles. So we don't just want to work our arms or our upper body, we also want to work our leg and our trunk. We want to do exercises for all of those muscles. And we'll go through the specifics of that in this session too. For flexibility, we want to do exercises and stretches on days where you perform other exercise. So that should be most days. So we want to stretch on the majority of days to help keep your muscles long so that you can move well and your joints function well. And we want to add daily balance exercises, especially if you're at risk of falling or if you're over 65 years. So for aerobic exercise, so we've got 150 minutes per week of moderate to vigorous intensity aerobic exercise. And what this shows you here is how you can get an understanding of what intensity means. So if we have a look first at the talk test, this is the most simple test for you to do when you're exercising at home. So moderate intensity on the talk test means that you can talk, but you cannot sing. So if you're outside and you're walking and you can talk to the person you're walking with, if you were to try and sing a song, you would be unable to sing easily. And that would mean that it's likely moderate intensity. If it was vigorous, you would be having trouble saying more than a few words, and you definitely would not be able to sing. And if it was mild intensity or less than moderate, you would also be able to sing. So that's how you can help to gauge how difficult the intensity is of your exercise through a talk test. The other type of test that we can use is an RPE test, so rate of perceived exertion. It's how hard you feel the exercise is between a rating of 0 and 10. So 0 means it's not hard at all, and 10 means it's the hardest thing you can imagine doing. And so if we look at moderate, we can see that moderate intensity exercise is a 4 to 6 out of 10. It's a 4, 5, or 6. And vigorous intensity exercise is a 7 or 8 out of 10. So note that it's not 9 or 10 out of 10. That's more than vigorous and not what we're talking about. But it's a 7 or 8. So if you're out walking with your partner and you think, it's about a 2 out of 10, well then it's probably mild and you might need to find a way to go harder. So that might be faster or hillier. If you're finding it's a 4 to 6, then it's moderate, and that might be where you need to be. In the clinic, the way that we actually measure intensity is through heart rate. So while it's easy for you to do a talk test or an RPE test on your own, with a heart rate monitor, we can work out what your intensity is. And so when you come into the exercise clinic, I can work this out for you. And so we know that moderate is about 50 to 70% of your maximum heart rate, and vigorous is 70 to 85% of your maximum. Again, it's not 100%. We're not going all out, but we are working hard. So why should you do aerobic exercise? Well, research shows that exercise can increase your long-term survival. So aerobic exercise that we're just talking about, so walking, running, swimming, cycling, it can improve your long-term survival. In some of the research that we've seen, all types of exercise and physical activity help to enhance survival rates by nearly 60%. So this meant that doing anything, moving more, can help enhance your survival. Now what we also see is that those that do more exercise, so those that were exercising for greater than 3 hours per week, had greater survival. So that means that the more you do, the better it is for you. And then we also know that the more vigorous your exercise is, the less chance you have of dying from prostate cancer. So when we look at this epidemiological data, so we take a big group of people and we look back in time and look at how active they were and who lived and who died, we see that those who were doing more intense exercise lived longer. So this means that if you're watching this and you have prostate cancer, I'm encouraging you firstly to move more, secondly to increase that time so you're doing greater lengths of exercise, and thirdly, if it's safe for you, to increase the intensity of your exercise, to include vigorous exercise. Now, one thing that we've seen from some studies is that an increase in aerobic fitness was able to slow prostate cancer progression. And this was shown by an increased PSA doubling time. So this study that I'm talking about specifically, it basically took a group of people and it put them through aerobic exercise training 3 times a week. And what they were able to find was that their PSA, everyone's PSA was slowly increasing over time. And the people who were exercising, theirs increased less. So it took them 72 months for their PSA to double, versus the group that was not exercising, it took them 28 months for their PSA to double. So it's very protective when we start looking at prostate cancer, survival, and progression. So an activity for you to do now is to look at how much exercise you are currently doing. And if you're watching this video, you'll be able to access the sheet that goes with this section that looks like this, and it's called physical activity level. And so you'll be able to look at that and fill that out based on what we've just talked about. And so this sheet breaks down your strenuous, moderate, and mild exercise levels, and it gets you to report on how many times a week you do that and for how many minutes each time. And this helps give you an understanding of how much exercise you're getting and in what intensity categories, and also how much resistance training you're getting. And that's really important for what we recommend next. So there's a second sheet that we'll give you if you're watching this video, and it helps to then guide you on how much exercise we're going to recommend that you start to do. So with aerobic exercise, there's a home program that goes with this session. And if you're doing nothing, then it gives you some stepped guidance on how to increase your aerobic exercise. If you're doing more than 50 minutes, it gives you, again, different guidance on how to increase your exercise. And if you're doing about 2.5 hours, then it gives you additional guidance there, because we can push you to different intensities based on what you're currently doing. So what about resistance training? So we know that we need you to do resistance training at least 2 times a week of all of your major muscle groups. And resistance training is measured by sets, reps, and load. So what that means is if I was doing a bicep curl exercise, and let's say I did 10 of those, that would be 10 repetitions. And then I'm going to have a break after my 10, and that's my rest. And then I'm going to do a second set. So my second set of 10 reps. And so then I'd have another break, and then I'd do a third set of 10 reps. And so even though the total number might be 30, because I've had breaks in between, it's actually 3 sets of 10 reps. And the load is the amount of weight that I'm using as I do that. So it's recommended for people with cancer and prostate cancer to build up to 2 to 4 sets of 8 to 12 repetitions of every exercise. And so we're looking at about 8 exercises in total. So we want to work your legs, we want to work your abdominal muscles, we want to work your back muscles, we want to work your chest and your upper back, we want to work your arms, both front and back. There's lots of different muscles that we can build up to get you strong. And if you're using the correct weight, At the end of the set, you should not be able to perform many more repetitions. So that means that if I'm lifting 10 pounds and I finish and I think I could do another 30, it's probably too light and I probably need to increase the intensity of my weight. So maybe I need 15 or 20 pounds. And in saying that as well, if I'm lifting 10 pounds and I can only do 4, it's probably too heavy and I might need to reduce the weight that I'm using. And so that's a really good gauge on if it's too light or too heavy. Can you do any more? And I want you to get to about 10 to 12 without being able to do many more. So what does resistance training look like if you're at home and you don't have any equipment? Here's 3 really simple exercises that you can do. So number 1 is a chair squat. So we put a chair behind you and you have your arms across your chest and you sit down onto the chair like you see in this photo, and then you stand up. So you sit down and stand up, and you do that multiple times, and that's going to work your legs. A wall push-up is another one that you can see in this photo where you have your hands on the wall and you lower your body towards the wall, lowering down and pushing away, and doing multiple repetitions of that. And finally, we have a plank. So this is kind of a bridge position with your arms on the ground and your abdominals on nice and tight, and holding for 5 to 20 seconds. So 3 really simple exercises that could get you started. When you come to the exercise clinic, we go through this in more detail so that we can tailor this to your needs, to your medical history, and to your current physical activity levels and conditioning. So how do we make exercise specific to your treatment and to your treatment side effects? If we look at some of the side effects, we're going to now go through some of the specifics of exercise. So if you have urinary incontinence, we can actually do pelvic floor exercises to improve your continence or prevent your leaking. So if we have a look at the picture over on the right, you can see a red section here, and that is your pelvic floor muscles. When you do a Kegel exercise, it activates the pelvic floor muscles, and that helps you to control your bladder if you're doing that correctly. When you have your prostate removed, they cut through those muscles, and so everybody has some difficulty after their prostate surgery because those muscles and how they've been reattached, it has to heal and recover. And so we want to practice doing Kegel exercises, and the easiest way to do that is seated or lying down to start with. So if you're sitting there in your chair, I want you to sit up nice and tall, have good posture and have your feet on the ground, and I want you to try and pull up, basically like you're trying to hold in a bowel movement. You want to try and do that and hold for a count of 5 and then relax. And you want to try again. You want to try and pull up like you're holding in a bowel movement and then relax. And you're going to do that 10 to 20 times, 3 or 4 times a day. But the catch is you need to be able to keep breathing as you're doing it. So you want to make sure you're breathing as you're holding. We want to make sure we're not getting global activation, so we're not activating through the abdominals or through the legs or through the bum. Everything's pretty silent. Now this is a really important area, and we have a whole module dedicated to this area with a pelvic floor physiotherapist. So if you have incontinence and you want to help improve that, you can contact the program and they can put you in touch with our pelvic floor module, and the physiotherapist can help guide you specifically on what you need to do. So why would you bother doing this? We have good evidence that shows that this can help you regain your function and your continence after surgery. If you're pre-surgery, we know that the more physically fit you are and the more that you can actually contract these muscles before your surgery, the better that you'll do after your surgery. So start as early as possible. One of the second side effects that we see all of the time is fatigue. And we know that about 80% of people with cancer will get fatigue at some point. Now, if you adopt a rest strategy, there's a really good chance that you're going to make your fatigue much worse. So what we do know is that if you remain inactive when you're tired and when you're fatigued, that fatigue will get worse, it will increase. And there is a way that we can improve it, but it involves moving. And that's really difficult to get your head around when you're tired, because ultimately we want you to move, but you're feeling really tired and you just want to stay in bed. We have really good evidence now that shows that exercise is the most powerful medicine for someone who's fatigued. It's actually more effective than any type of pill you can take. So in a study that compared exercise with a psychological intervention and with a pill, they found that exercise was the strongest intervention to help decrease your fatigue and increase your energy. So hopefully that helps you to think about how you get active. Now with fatigue, some of the caveats are that we actually want to make sure that you're not making your fatigue worse by moving too much, and we need to move often. So how I get you to start exercising is by moving regularly. So I want you to exercise for 5 or 10 minutes a day, and that might be as simple as marching on the spot to start with. If you're really tired and your fatigue is really high, you might be on hormone therapy and finish radiation treatment, then we want you to start somewhere. So start slow and do it every day. So you want to find a way that you can move daily, even if that's doing a tiny amount, and then we just build from there. So you start with 5 minutes a day, and then when you can do that with a positive response, that means that you're not getting more fatigued, then we add an extra 5 minutes. So you do 10 minutes a day. And then when you can do that for at least 6 days a week with positive response, then we add another 5 or 10 minutes. Slowly building on top of that so that you can then do 30 minutes a day. But we do not go from 0 to 30 in 1 week. So it's a slow progression. We know that to enhance your energy, it has to be this slow build. Otherwise, you could actually make yourself more fatigued. And if you have questions about that, any of our exercise physiologists within our program can actually help you manage that. One of the other side effects of some of the prostate cancer treatments, such as hormone therapy or androgen deprivation therapy, are body composition changes. So this is a really common change that we start to see in someone who's on hormone therapy. And that is an increase in fat mass, particularly around the midsection. Okay, it can be a decrease in muscle mass across the whole body. So we see muscle being lost in the legs, in the arms, in the trunk. And this is a side effect of the hormone therapy. The hormone therapy is very effective at controlling your prostate cancer and kind of shutting it down. But what it does is it means that you end up with no testosterone. And the testosterone and hormonal changes that are the side effect of this therapy mean that your composition changes. This is important because we know that over the course of a year, your body fat on hormone therapy can increase by about 10%, and your muscle mass can decrease by about 4% just in that first year. And that's enough to take you from being healthy and active to putting you at risk of heart disease. So those small changes can be very impactful when we start to look at your risk of other things. Also, a reduction of muscle mass can reduce your fitness of your muscles, and that can compromise your muscular strength and your physical function. So you might be starting off from a weak position when you first get cancer. Maybe you're not very physically active. If we reduce your muscle mass by another 4%, perhaps you can't get out of a chair very comfortably now. It might make your activities of daily living quite difficult. It might make walking for you quite hard. And so we can use exercise to help overcome these body composition changes. We know that exercise, especially resistance training and combined with aerobic training, can help preserve your lean muscle mass. Okay, so your lean body mass is the amount of muscle that you have. It can help preserve your strength, so your ability to actually move your body using your muscles, and also your function. So the ability to do those day-to-day tasks like getting out of a chair, walking around, etc. And it can help prevent gains in fat mass. So by moving regularly when you're on hormone therapy and doing the right kind of resistance training, we can help preserve these things, and we can actually help increase your muscle mass and help protect your body long term. One of the other side effects that we see as a result of hormone therapy is a reduction in bone mass or bone loss. So what we can see in the picture here on the left is actually normal bone matrix. So it's what healthy bone looks like. And the picture on the right shows osteoporosis. So this is not healthy bone. This bone has decreased its bone density. And that can mean that if you were to fall, you could fracture something like your hip. So a reduction in bone mass leads to an increased risk of fracture and an increased risk in associated disability from things like fracture. Now we know that hormone therapy can lead to this reduction in bone mass, but the good news is we know that exercise can help to counter that. So by doing things like aerobic exercise and resistance training and impact loading, we can help to maintain and also increase your bone density. When we look at bone density for people who are on hormone therapy versus those who are not on hormone therapy, we see that compared to age-matched controls, those who have had hormone therapy in the past have less bone density. So this means that this population, people who are on ADT or have previously completed ADT, need to be doing the right kind of exercise to help improve their bone density. So what is the right kind of exercise? Well, it is aerobic exercise, and it is resistance training, and it could be impact exercises. So if we look at aerobic exercise to improve bone density, if we look at the hierarchy of things, we want to load you versus unload you. So that would mean that walking is better than swimming, and that walking up a hill is better than walking on the flat, and that walking upstairs is probably better than that again, and that running is probably the most loading that you can get, and running up a hill even. I'm not saying you need to run, but that's kind of how things step in terms of bone density and loading. So we want to do what you can do safely. So that might start with walking on the flat, and you might build to walking up a bit of a hill to help improve your density. The other thing that's important is resistance training. So we know that by doing things with our muscles, all of those origins and insertions of the muscle help kind of pull on the bone a little bit, and that creates remodeling. And the remodeling makes the bone stronger. So resistance training is really important when we're talking about bones. And then impact exercises includes things like some small jumps. So it might look like this, where you jump up and down. It could look like something slightly different, where maybe you're bounding or running. And that may or may not be appropriate for you, and your exercise physiologist can help guide on that. One of the other side effects that we commonly see from prostate cancer treatments is a decrease in your sexual health and a decreased libido. So we know that exercise can help to improve this. So post-surgery, during ADT, and even after hormone therapy, normally your sexual activity and libido will be decreased. And what we do know from some of the research is that by engaging in resistance training for a 3-month period can help to improve that. So there was one study that showed that the people who were doing the exercise over 3 months versus those who were not were able to maintain their sexual activity. They're able to increase their libido, and they're able to increase their feelings of masculinity just through exercise. So this is something important to consider, especially if you are coming post-surgery. Maybe you're having issues with your erectile function, and our sexual health team of nurses can actually help support, your recovery and your rehabilitation in that area. But as can exercise. Exercise may help you regain some of those feelings of masculinity and regain your libido. Other side effects that are really common are things like hot flashes. So 80% of people who are on ADT will experience hot flashes at some point. We don't have a lot of evidence that shows that exercise can help reduce hot flashes, but what has been shown to potentially be effective is deep belly breathing or diaphragmatic breathing. So when you feel a hot flash coming on, if you take a deep breath, it helps fill your belly with air and then release that, and try doing that a few times, you may be able to reduce the severity of the hot flash and the frequency that they come on. You definitely will not be doing any harm by trialing this. Mental health is another area that we see really compromised by all types of treatment for prostate cancer and from the cancer itself. So decreased mental health is really common in prostate cancer. We have a clinical counselor as part of our program that you can access to help you understand and how you can improve your mental health and help talk through some of those elements. We also know that exercise is a great way to help improve your mental health. There was a review that came out in the last few months in 2018 that helped show that exercise is one of the first line pieces of management and should be employed for everybody that has any type of mental health issues. Quality of life is another area that we see decrease due to prostate cancer and prostate cancer treatments. And what we know is that exercise of any kind and physical activity can really help to improve your quality of life. So how well you function within your life and how you feel about that. Bone metastases and advanced cancer is another area that we see in some people with prostate cancer. And if you have bone metastases or an advanced prostate cancer, it's really worth speaking one-on-one with the exercise physiologist in your center to make sure you're getting the specific advice that's appropriate for you. We know that exercise is safe when you have bone metastases, but it has to be done the right way because it could be dangerous if you do it the wrong way. So definitely reach out to the program and speak to the exercise physiologist, either myself or one of my team members, about how you can exercise safely with bone metastases. Because we don't cover that specifically in tonight's session, but we can cover that in our one-on-one clinic. Other side effects that we see less common, but are still possible, are things like peripheral neuropathy, a numbness, burning or tingling in the fingers or in the toes, and lymphedema, which can be a type of swelling that can happen after radiation. These are less common, and if you have these things, I want you to speak to the people in your program, so the exercise physiologist, to help you understand how you can best manage those with exercise. So I guess it's really important to choose the exercises that are going to specifically reduce and manage the side effects of your prostate cancer treatments and improve the response to your treatment, because it's really individualized. This is where the clinic is really valuable, because you can come in and one-on-one we'll work with you to help you understand what you need specifically. So how do you start exercising, and how do you do it safely? Safety is number one, and if you are unsure about how you start exercising and if it's safe for you, then you can definitely speak with your doctor about your exercise intentions, especially if you've been inactive for a period of time. You may be post-surgery and want to understand when is it safe to start. Now the good news is that as well as your doctor, an exercise physiologist has the capacity to be able to clear you for exercise and screen and make sure that you are safe to engage in exercise and help you understand what exercise you are safe to do. So you can either speak to your doctor or you can come and see us and we can actually help you understand those pieces. We want to make sure that we always include a warm-up and a cool-down, and that incorporates mild aerobic exercise and stretching. So if you're going to go for a walk up a big hill, we probably don't start on the hill if you can avoid it. We want to start with gentle exercise, warming your body up. We maybe even do some stretching at the start if your joints are tight and stiff, and then we get into the harder stuff. It's really important to also start slow and to build slow. So this is within each session, and then also how you build week to week. If you're currently doing nothing, we want to build you slowly. So you start with something. That might be 5 or 10 minutes a day, or maybe it's 20 or 30 minutes a week. And then each week you add a little bit more. You do a little bit more volume, so a little bit more duration, and a little bit more intensity once you're doing at least half an hour on 3 to 5 days a week. If we do that, we can avoid doing harm. I guess the big thing to remember is that some activity is better than none. So if you're sitting there thinking, but I'm doing nothing, how do I start? Do something. It actually doesn't matter what you do at the start. Do something, go and do it, start doing it regularly, and then we'll make it specialized once you start doing something. So recommendation number 4 is to consult a qualified exercise professional to safely guide you through your exercises that are suitable for you and your situation. So there's different ways that someone can be a qualified exercise professional. So within our program, we have certified exercise physiologists, and we are certified through the Canadian Society of Exercise Physiology, or CSEP. Many people are also registered with Exercise Medicine Canada, and then you may have a local physiotherapist who can also consult with you. And the important thing is that you want to make sure that whoever you speak to has experience working with cancer, because many of these people do, but they're not guaranteed to. So come to our program because we can actually help you. We specialize in working with prostate cancer. All right, so as part of getting you started and doing this safely, we need to set some goals and overcome barriers. So with goal setting, it's really important to first start with some short-term and then long-term goals. What is it that you want to achieve? Do you want to be able to walk up a flight of stairs independently? Or is it that you want to be able to run after your grandchildren or keep up with your partner as you're walking uphill? We can really define those goals, and we want to make sure that they are specific and measurable, that they are action-oriented, that they are realistic, and they are timely. So that means I'm not going to say, I'm going to start walking. But instead I'm going to say, I'm going to start walking 3 days a week for 15 minutes at a moderate intensity, and I'm going to do that with my partner around the park. So that's a really great way to set a goal to start with. My long-term goal might be to be able to walk for an hour. That's where I want to get to in a year. But I need to start with a shorter amount of time first. And then how do we make you successful? Well, we need to first identify what's going to stop you being successful. So how do we identify your barriers to exercise? I normally ask people, what is one of your barriers to exercise? What's going to stop you exercising successfully? And normally it's something like time. I just don't have any time, I can't do it regularly. Or willpower, or maybe you've got a sore joint, a sore knee, a sore elbow that's preventing you from exercising regularly. Maybe you have family or work commitments that are, eating into your time and making it difficult. Or maybe you just don't have any support and it's really difficult for you to actually get out and find the time and the motivation to get out and exercise. With all of these things, we can actually work towards overcoming them. So if time is your biggest barrier to exercise, then we need to schedule it better. We need to figure out when can you fit it in. How do we sneak it into your day? If it's work that's the barrier to exercise, then again, we need to schedule it in. How do we fit this exercise in? Maybe you're post-surgery and you're not sure if you can exercise yet. And so in that case, I'd recommend speaking to one of the exercise physiologists in our program to help you understand what's appropriate for you and when can you expect to be able to return to exercise. The good news is that most people can walk at any time. So that's something to think about. You should be able to get out and move, even just a little bit. And so once we identify what your barriers are, we can help you overcome them. And through our exercise clinic, we really work with you on this. We figure out what's going to get in your way or what has been getting in your way, and how do we build that? How do we get you over that one? And so exercise support and next steps is a really important one. What do you have access to now? So we have our prostate cancer supportive care program exercise clinic that I've been speaking about tonight. This is one-on-one consultation with an exercise physiologist, and it assesses your exercise needs and develops your plan of action. So it helps you understand what you need to do, develops a plan on how to do it, and you check in 4 times a year to kind of make sure that you're successful and to problem solve if things come up along the way. In Vancouver, you may have access to a cardiac rehab program. So if it's determined that your biggest risk factor is actually cardiovascular disease, then it might be more appropriate for you to go into a cardiac rehab program than it is to go into a prostate program. And we can always talk about that one-on-one. There are other local community programs and companies that do exist. So in Vancouver and in Kamloops, I know that we do have some prostate cancer exercise programs that operate out of a community setting. So you can go and sign up and pay a very small fee and work out with an instructor that knows a little bit about prostate cancer, and you can be in the room with a bunch of guys who have had prostate cancer and do resistance training. It's a bit more of a fun way to kind of stay motivated and do some exercise. There's also things like dragon boating teams. So again, in Vancouver, we have the Butts in a Boat team. This is a group of guys who have prostate cancer who every summer get in the boat and they start paddling together and they end up going into some races and they work as a team on the water. It's a great experience. And then we also have HealthLink BC, the physical activity service, or 811. So anybody can call 811 and have access to exercise physiologists. And so if you were to call 811 and ask for physical activity services for cancer, they'd put you through to the oncology specialist, exercise physiologist. And this person's been trained in cancer. And so regardless of where you live, you can call 811 and ask for physical activity services for cancer and be put through to someone who has great knowledge in helping you understand what's safe for you to do, how do you build a plan, and how do you do it regularly. So similar to what we do in person, but you can do it on the telephone. It's a great service that you can now access. And then sometimes we also have research studies that are ongoing, and you can sign up to those, and our program will let you know when they are on. So what is a summary of tonight? Well, ultimately I want you to move more and to sit less. We know that the more movement that you do, the better. So if you take one thing away from this, it's to start moving and to do it regularly. Ideally, once you're moving, we then want to build you up to doing at least 150 minutes of moderate to vigorous aerobic exercise per week. So that might look like 5 30-minute sessions a week where you go walking. The third thing we want you to do is to include resistance training. 2 sessions a week at a minimum. We're looking at 8 to 10 exercises, so working your whole body, and doing 1 to 3 sets of 8 to 12 repetitions of each exercise. We also want to make sure we include flexibility exercises on days that you exercise, so basically stretch when you exercise, and include balance exercises if you're over 65, if you have osteoporosis, or if your balance is poor. And a balance exercise can look as simple as standing on one leg. So what do you do from here? And what we want you to do next is start recording your exercise. So record your aerobic exercise for the next few weeks. Call our program on this number here, and then from there you can get hooked up with the exercise clinic, and you can start to come in and we can start to help you one-on-one develop that exercise plan so you can hopefully be successful incorporating this advice and these types of movements into your prostate cancer journey. Thank you.